Hi, welcome to Iron's Health Talk with Dr. Akram. I am Akram. In this program, we will be talking about all kinds of different health issues with different experts in the field. Today, we'll be talking about silent killer, hypertension. So sit back, relax, enjoy your time with us. Let's look. Hypertension. As for 2004, approximately 1 billion adults, or 22% of the population of the world, have hypertension. It is slightly more frequent in men, in those of low socioeconomic status, and it becomes more common with age. In 2004, rates of high blood pressure were highest in Africa, 30% for both sexes, and lowest in the Americas, 18% for both sexes. Rates also vary markedly within regions, with rates as low as 3.4 for men and 6.8 for women in rural India, and as high as 68.9% for men and 72.5% women in Poland. Is hypertension new to our society? Let's look at the history. Awareness of the clinical aspects of hypertension dates to antiquity. The Chinese Yellow Emperor, classic of internal medicine, 2600 BCE, noted if too much salt is used in blood, the pulse hardens. The symptoms similar to symptoms of patients with hypertensive crisis are discussed in medieval Persian medical texts in the chapter of fullness disease. Fullness disease was presumed to be due to an excessive amount of blood within the blood vessels. Historically, the treatment for hypertension consisted in reducing the quantity of blood by bloodletting or the application of leeches. This was advocated by the Yellow Emperor in China, Cornelius, Celsus, Galen, even Hippocrates. Description of hypertension as a disease came among others from Thomas Young in 1808 and especially Richard Bright in 1836. The first report of elevated blood pressure in a person without evidence of kidney disease was made by Frederick Akbar Muhammad, 1849-1884. High blood pressure or hypertension rarely has noticeable symptoms, but if untreated, it increases the risks of serious problems such as heart attacks, strokes. Around the world of adults in the UK have high blood pressure, although many will not realize it. The only way to find out if your blood pressure is high is to have your blood pressure checked. But before that, let's look at what is hypertension. What are the symptoms? Is it prevention? What is the prevention? Oh, and much more. Let's welcome our special guest, Dr. Feroz Mubarak. He is a GP and he is a clinical trust. Feroz, I would like to tell a little bit more about you. What do you do generally?
I'm a GP by profession, but I work as a clinical director in primary care SAS. I've got a background, I trained as a surgeon. So I do some surgical interventions, and also I do expedition medicine.
Oh, you do expedition medicine as well, and you work in hospital as
I do work
as well.
Yeah, I do work. Yeah, I do work in the urgent care. But my main lateral interest is medical legal. So I work as a medical legal advisor.
Medical legal advisor. So what is your interest in hypertension?
Hypertension is the mother of all vascular disease. So it's large part of primary care medicine because, as you read, it is the cause of silent death, which means anything related to vascular, there is a part of it. So it's more of a bread and butter of general practice medicine as well. I think important news to send to everybody is it doesn't come in one day. Of course, there is a build up to it. There are a lot of modifiable factors which we need to know and which we need to avoid. And also, when you have the condition which has been diagnosed, it's very important that people are not ignorant about it.
So they
can prevent significant vascular damage.
Is it that common as I said? Because
it's very common in the UK and England. 1 in 4 adults have got.
So 1 in 4 adults in UK has got high blood pressure.
Some form of high blood pressure.
Right. So without treatment, is there any way they could do anything without treatment?
So it depends on how high it is. So there are stage 1 to 4. So when we say starting, if it's slightly high and you are younger and you don't have any other comorbidities, then it's mainly lifestyle change and diet which you need to look into. We can go into details in a bit. So if you are, the sooner you find out, the better. The thing about medicine is the sooner you find out about a condition, there's something you can do about it. Same thing applies to cancers. So it is important people are not ignorant about it. There are certain ethnic groups who are at more risk than other ethnic groups, and also certain people with certain lifestyle and smokers, they are at high risk. So you need to be monitoring your blood pressure quite regularly, at least every 5 years if you're under 40.
Okay. Can you tell what is simply high blood pressure or hypertension?
Okay, so you got the blood which carries oxygen, which goes around your body, giving the oxygen to all organs. We call end organs. We are talking about brain, heart, your kidneys, your muscles, your liver, everything. So what takes that oxygen to those end organs is the blood. So the blood needs certain flow to it. So the flow is produced by your heart. So your heart has to constrict to put a pressure into the flow which goes around, and then of course it comes back into the heart.
So it's simply like a
pumping system.
It's like a water pump or motor.
Yeah.
Is that simply
Correct.
like that?
Yeah, it's like that, but it's a circular.
It's a circular, rather, yeah.
So it's got double circles. In humans, of course, it goes into your lungs to get more oxygen from the air, and that goes back into your heart, and then heart pumps it back against another circulation into the organs, where the oxygen is delivered to those cells in those organs.
So as you said, it's a double circle, isn't it?
Yeah,
it has to go through the lungs first.
So the main junction is the heart.
Heart, yeah, okay.
So heart pumps the deoxygenated blood. The blood
so that
has
is
got
the
less oxygen into the lungs.
Okay.
And the lungs have got the air exchange. So we breathe in and breathe out oxygen, and then oxygen is kind of exchanged in the lungs.
In the lungs.
And then oxygenated blood goes back into the heart to enter the second circulation, and that circulation goes into the other part of our body to supply that oxygen. And then in those end organs, the oxygen is exchanged to carbon dioxide, and it comes back again into the heart, and then to start the next cycle going into the lungs.
I think that's kind of clear. Before we go into the next bit, what I'm going to say, this is a live program, so you can always call us, and the number will be on the screen. And you can follow us on Facebook or Twitter under the same name, is Iron Health Talk with Dr. Akram. And you can also watch our program on Facebook Live. Okay, let's go back. So why do we need this pressure to...
So every flow of fluid need a pressure to carry it.
Right.
So usually you have got an average pressure around 120 over 80.
So normal blood pressure is 120 over 80.
Just around that. So there is a margin to it. So if you go above a certain level, it becomes higher blood pressure. If it goes below a certain level, it becomes lower blood pressure. We call hypotension.
Okay. So hypertension
and then hypotension.
Hypotension.
Yeah, so we work around a range, because nobody's blood pressure will stay exactly the same. So certain activities will increase the blood pressure, certain activities, the relaxations and things will reduce the blood pressure. But there is a range we would work on. It also depends on age as well. Children, teenagers, 40 years.
I'm going to hold you 1
years.
second there, because there's a caller coming on. Let's join the caller and we'll continue with the question. Please stay there. Hello.
Hello.
Hello, hi, welcome to Iron Health Talk with Dr. Akram. What's your name, sir?
Assalamualaikum.
Walaikum assalam.
My name is Nafi. And I'm talking about on behalf of my dad.
Thank you very much for your call, sir. Yeah, you can go ahead with your question.
So my dad currently has headaches and dizziness, and sometimes he feels like he's falling, and his head gets like really, really hot.
So he's got headache, dizziness.
Yeah, and he's had like complication, health problems.
Has he got high blood pressure as well?
Yeah, he used to have high blood pressure. Sometimes does now.
Is he on treatment with high blood pressure?
Yeah.
Okay.
And had a kidney transplant 2 years ago.
Oh, he had a kidney transplant as well. Okay, that's quite interesting. Yeah. And do you know by chance what is his normal blood pressure?
Normal blood pressure is like 130 over 80.
That's for his your father's blood pressure, is that right?
Yeah, yeah.
Okay, so does it go up sometimes?
Yeah, it goes up.
Okay.
Yeah, his days like really bad. Goes up to 200.
Okay. Okay, we clear about your situation. Can you tell your question now?
Yeah, okay, go on. Yeah.
So you want to, do you have a question, or you just wanted to ask?
No. I'd like to know how it is. I just want to know why this is.
So, is that clear? Feroz?
Yes, I think I got your question. So your dad has got those complications, and he does get this headache and dizziness, and you need to know why it is, I assume. Is that right? Yeah. Okay.
Sometimes he feels like he's falling, but
okay. So he loses balance, does he?
Yeah.
Okay. So I think there may be many reasons why it happens, especially because your dad has got a very complicated medical history, especially he had a transplant, renal transplant. Usually you got balance problem. If it is to do with the blood pressure, it is to do with the low blood pressure rather than high blood pressure. Okay? You can have headache from high blood pressure and low blood pressure, but usually headaches come from higher blood pressure. But I think if you're telling me that his blood pressure is sometimes 130, 80, sometimes 200, and I think there may be a rapid fluctuation with blood pressure causing his dizziness.
Yeah, he didn't get 200 now, but he used to get
so you see, so first thing it tells me, somebody with a renal transplant should have a really well managed blood pressure, because if not, the transplanted kidney will go into trouble. So I think he might actually need to be reviewed by the specialist again to make sure that there's nothing else causing this blood pressure. It may well be that his transplanted kidney is causing the problem with blood pressure and it's not filtrating very well. But it's more of a specialist area. You need to actually liaise with the specialist, because it's a cause and effect. Cause could be because of the kidney, and the effect of the blood pressure, high blood pressure, can cause the new kidney to fail as well. So it is important that I think he might actually need a 24-hour or 72-hour blood pressure monitoring, which would actually give him an idea what time or what causes this blood pressure. You need significantly more advanced investigation into his problem rather than a normal general blood pressure reading.
Yeah, his blood pressure at the moment is normal, constantly normal now. But it's just that sometimes they've investigated everything and the hospital.
Yeah.
They put him on and everything.
Thank you very much. Are you happy with the answer, sir?
Yes.
Okay, thank you very much. We'll see you next time, or you could call us in some other programs, and thank you for calling us.
Thank you.
All right.
Bye.
Okay, let's go back.
Okay. So we're talking about the blood pressure.
Blood pressure.
Yeah. So you get this power up. I forgot where we left, but to continue with the circulation, and the reason why you get the blood pressure is in a daytime and night, and depending on our activities, our blood pressure will go up and down slightly, but there is a margin which we would work on. So that's where we work about the cutoff of blood pressure and how persistent it is. So when you have got a problem with blood pressure, which means your resting blood pressure, or majority of the time your average blood pressure is higher than the normal, and that's the reason when you need to monitor what the blood pressure remains as and what you need to do about it.
Signs and symptoms of blood pressure generally.
So majority of the time, unless it's stage 2, you might not have any symptoms. But there are some people who will get quite a lot of symptom when they have got slightly elevated
Feroz, can
blood
you
pressure.
just hold? There's another caller, so
Yeah.
please remember where we are.
Yeah.
Hello, sir. You're
Hello?
online.
Hello?
Hello, what's your name?
Samira.
Yeah.
Samira.
Samira, thank you for calling us. Would you like to go ahead and tell your question?
I have a query. So my dad, he's usually cold. So when he sweats, he gets really cold after. Is it anything to do with the heart or anything?
Sorry, he feel cold most of the time. You're asking whether it has got anything to do with the heart, is it?
Yes, it is. Yes.
Okay. And he feel cold all over his body or on his peripheries, on his fingers and in his feet?
He feels cold all over his body.
Okay, so sometimes low blood pressure can give you that kind of symptoms, but most of the time if it's generalized coldness, it may be something to do with the heart rather than actual blood pressure, but it may well be something to do with his hormones as well, because sometimes low thyroids can cause these kind of problems. But blood pressure itself shouldn't give generalized feeling of cold most of the time, especially in a warm or hot weather. So they may need further investigations into that.
Thank you very much, Samira, for your call. Has he answered your question? Okay, let's go back, sorry.
Okay.
Signs and symptoms we were.
Yeah, so we talked about signs and symptoms. So most of the time you wouldn't have any signs or symptoms until you develop some side effect or advanced effect of these higher blood pressure. But generally headaches, some people feel dizziness, some people feel a bit of a blurriness of vision, a bit of a palpitation,
Palpitations,
faster
headache,
heart rate,
blurriness, yeah.
chest pain, bit of a shortness of breath. Sometimes people get pins and needles, tingling sensation in the peripheries. Some people get dizziness to do with the persistent high blood pressure. And in occasional times people get neck ache
as well.
Yeah, and low mood. And these are quite an unusual symptom with them.
So when you suggest for them to check a blood pressure, what age or like what?
So
You told about the symptoms.
Yeah, so generally if you are 40 or above, you should be checking your blood pressure at least every 5 years.
Every 5 years.
Yeah,
14
if
and
you
above.
have no risk factors at all.
Okay.
But if you have risk factors, for example, if you've got a family history of high blood pressure or any vascular disease, for example, cardiac problems, stroke, peripheral vascular disease like, pain in their leg when they walk for a longer period of time, and anybody who has got diabetes in the family, they should be checking their blood pressure at least every year.
Every year after 40 years of age.
From 40 onwards.
From
but of
40.
course, if somebody has got stronger, we say more than one risk factor,
Okay.
the more number of risk factors somebody has, the more likely they will develop high blood pressure or the cause of that. So for that reason, they should consider checking it earlier. Somebody who's 25, there's no harm in checking their blood pressure every year. But I would recommend from 40 onwards, you need to be a bit more careful.
Exactly. That's
And
good.
one of the important factors is smokers. Smokers, even if they are 25, they should be checking their blood pressure. And obese people.
So
People with obesity.
people can still have high blood pressure without any symptoms.
Yes, absolutely.
So that's really important that everybody should check
Yeah.
the blood pressure after that certain age.
Correct.
Can children have blood pressure as well, or will they have
Yes,
symptoms?
children can have blood pressure, but that's for a totally different reason.
Different reason.
Yeah, so that need specialist investigation into, because there's a lot of organ damage or there's a lot of endocrinological conditions which needs treating. It's not like just the blood pressure is going to sort that out.
Exactly. So we're not going to talk much about children today, but it's generally about adults. But I just want to remind the viewers that it's possible the children can also have blood pressure problems. So is a hypertension is a new trend, or it's been as we said, it's been around before, but we just say like, yeah, grandparents time that no much hypertension.
No, so we are very good at diagnosing people now compared to 50 years ago or 100 years ago. So that's one of the reasons why we think why we find that there are more hypertensive patients now. And also the goalpost has changed in terms of what are the levels of blood pressure we we accept it as high blood pressure or normal blood pressure. There were trends where the high blood pressure has been seen as an important part of a compensatory mechanism in your body, because that is why it is actually called essential hypertension, because it's essential, it's needed for the body to do it. Because one of the process of building up high blood pressure is because your arteries become calcified. So it's just like you get limescale building in a pipework.
That's right.
You get calcium building on your arteries when you get older.
All right.
So it used to believe that that happens to the microvascular level as well. I mean your brain and your heart and things.
Okay.
So they used to believe that you needed a slightly higher pressure to break through this resistance. But there's significant amount of evidences now to say it's not the truth.
That's not the truth.
It's actually an effect rather than a cause. So you can't say, okay, well, you need slightly high blood pressure, let's leave you on 118, 100. That's not the case.
No.
So we need to maintain the blood pressure as how it was before, because it has got a domino effect. So if your blood pressure is higher, then that also changes the microvascular nature of the the vascular system. And it causes further damage. That causes more stiffening your arteries, and that causes further elevation of blood pressure. So no, you need to make sure that you maintain it at a normal
hypertension
level.
is it in rise? Is it get more people hypertension?
I think so. So there are multiple factors. It is possible that it is in rise.
And we can talk about the risk factors as well.
Correct. Yeah. So one of the risk factor of high blood pressure is sedentary lifestyle. So we just do office jobs basically.
Office jobs.
So which means that our body is comprised of a lot of muscles. The blood vessels go through the muscles. So when we work our muscle work as a pumping system to kind of help the heart. Don't rely just on the heart for pumping. So your muscles help the blood vessels to pump blood back into the system as well.
That's a good explanation, actually. Yeah.
Yeah. So and also the way how the heart works is the more blood returns to the heart, the more effective its pumping mechanism is. So so that is very effective. So if you don't have enough blood coming into your heart doesn't pump as powerful. Okay. So for that reason, it's important that the blood come back into your heart in a more consistent way, which makes your heart work better. And that's why exercise is very important. And if you can compare 100 years ago, what proportion of people did office job compared to physical work, there's a significant number of that population now doing office type work. So that may be one of the reasons why we have got a situation where blood pressure is rising. And then on top of that, food and obesity and smoking. Smoking has actually in Western Europe gone down, which is a good thing.
That's a good thing,
It used to be a fashionable thing. People smoke, it came in the movies, and people used to advertise in movies. So it was one of the fashionable things, but not anymore. And also now the Western world, throughout the world, smoking is discouraged. So smoking actually is in a fall. But with regards to the blood pressures going, so a lot of people have processed food now. So processed food have got high salt levels.
Salt level.
Yes, and takeaway food. Takeaway has got a lot of salt level, because sodium increases blood pressure in the system. And also, of course, we talked about obesity. So obesity, the deposition of fat goes around all your major organs, and also it deposits in your arteries as well, causing atherosclerosis, so which means the narrowing of the artery. So if you got one constant pressure and you got a smaller tube and a bigger tube, and same amount of liquid going through that, the bigger tube, the pressure in the bigger tube will be significantly lower than the pressure in the smaller tube, because of the lumen. The lumen will be smaller. And that's what happened to the blood vessels. The blood vessel gets narrower, so the blood pressure goes higher. And on top of that, as I mentioned to you, because of calcification of these blood vessels, when you go over 40, that further reduces the flexibility of the blood vessels. So the blood vessel is stiffer than it would have been 10, 15 years ago. So if the blood vessel doesn't give way to the pressure is the only thing which can increase. So it goes up.
Okay. Okay, that's good explanation. I think we're going to go for a short break. Today we're talking about high blood pressure. This is quite important condition in our society. There is, as we said, is huge amount of population is being affected by this condition. That's due to our lifestyle, and everything has changed, and sedentary lifestyle, office work, and as our special Feroz Mubarak explained. We're going to talk more about the treatment and everything to do with high blood pressure after the short break. So be with us.